Sometimes what seems like a simple nuisance, like an insistent itch, can be a sign of something much larger. In older adults, this is even more important. After all, the body doesn't respond the same way it used to and tends to express internal problems in subtle ways. A constant itch, for no apparent reason, may be alerting you to something beyond the skin. Often, it's the only silent warning that something inside the body needs attention, and ignoring it can delay important diagnoses. The skin, being the largest organ in the body, reflects internal imbalances more often than one might think. Therefore, understanding the signals it sends is more than a matter of comfort, it's a matter of health, and there are 6 specific conditions that deserve extra attention as they involve real risks to the health of those over 60. It's common that when feeling a persistent itch, the first impulse is to reach for creams or ointments. But what if those solutions don't work? When the discomfort persists, always returns to the same spot or starts to spread, it's time to look more carefully. Some skin conditions are directly linked to problems like diabetes, liver disease, kidney failure, and even certain types of cancer. Knowing how to recognize the signs helps to seek medical help at the right time and can completely change the course of a diagnosis. If you want to understand how to better protect your health or the health of a loved one, watch this video until the end. And if this information makes sense to you, consider subscribing to the channel and giving it a thumbs up. It really helps spread knowledge that can make a difference. Often aging is seen as a phase only of losses, but it can also be the ideal time to reconnect with your own body and listen more attentively to the signals it sends. Edgar Cayce, known for his insights on the relationship between body and mind, believed that the skin was a kind of mirror of the soul and emotions. While not everything he said is accepted by conventional medicine, his integrative view invites us to reflect. Could that recurring itch be saying something beyond the obvious? The answer for many experts today is yes. Even mild symptoms, when repetitive, should be taken seriously. It's not just about relief, it's about prevention. And in many cases, acting early is what makes all the difference. One of the most common causes of persistent itching in older adults is xerosis, or excessively dry skin. As the years go by, the skin produces less natural oil, becoming thinner, more fragile, and prone to irritation. This intense dryness can cause constant itching, especially on the legs, arms, and back. Although it seems like something simple, xerosis can be the starting point for infections, fissures, and more serious inflammations, especially if the person scratches frequently. In addition, dry skin can indicate dehydration, poor nutrition, or side effects from medications. Therefore, maintaining adequate hydration, both internally and externally, is essential. Ignoring the discomfort and treating it only with creams without medical investigation can mask a problem that needs to be looked at more deeply. Small signs should not be underestimated, especially when they persist without apparent explanation. Another important condition is cholestasis, which occurs when there is a blockage or reduction of bile flow in the liver. This problem usually causes intense itching, especially on the palms of the hands and soles of the feet, without visible skin lesions. It's a silent symptom that something is happening with the liver, which may be related to chronic liver diseases, gallstones, or even more serious complications. The danger lies in its subtlety. Since there are no spots, swellings, or other external signs, the itching is often treated in isolation and the real problem continues to progress. Simple blood and imaging tests can help detect this type of alteration, but the symptom needs to be valued. When the body speaks in this way, it's asking for help. And the sooner this request is heard, the greater the chances of effective treatment. Kidney failure can also manifest through continuous itching without an apparent cause. This occurs because the kidneys stop adequately eliminating certain toxins from the body, and these substances end up accumulating in the blood. The result is a feeling of generalized itching, especially during the night. This symptom usually appears subtly and intensifies over time. It may seem like just another discomfort of age, but it's a serious indication that the kidneys are overloaded. In older adults, this condition is even more delicate because often the classic signs, such as swelling or high blood pressure, appear late. Paying attention to the itching can be a way to detect this problem before it worsens. Consulting a doctor and performing kidney function tests may be the step that was missing to discover the origin of the discomfort and start an appropriate preventive treatment. Atopic dermatitis is another relevant factor, especially in people with a history of allergies or skin sensitivity. Although more common in childhood, it can persist or reappear in old age, causing intense itching, redness, and lesions in areas such as the neck, folds of the arms, and legs. The aging of the skin makes these flare-ups more difficult to control, as there is less resistance to irritating agents. In addition, emotional factors such as stress and anxiety, quite present in this phase of life, tend to worsen the condition. Often, the older adult believes they are dealing with a simple irritation, when in reality it's a chronic inflammation of the skin that needs constant monitoring. The good news is that, with proper guidance, it's possible to control the symptoms and greatly improve the quality of life. Identifying the triggers and adjusting daily habits is an essential part of this process of relief and prevention. Another point that deserves attention is the possibility of itching being linked to cutaneous or systemic lymphomas. This is a type of cancer that in early stages can manifest exclusively as persistent itching, especially at night, without the presence of visible lesions. This is one of the reasons why doctors insist that recurrent itching, without an apparent cause, should be investigated with caution. Early diagnosis in this case makes a huge difference in the success of the treatment. When detected in the early stages, lymphoma can be treated much more effectively, avoiding future complications. It's understandable that many people are reluctant to seek help out of fear or ignorance, but that's precisely why it's so important to talk about the subject. The more you understand the body and its signals, the easier it becomes to recognize when something is not right and act with responsibility and care. Autoimmune diseases are also among the possible causes of unexplained itching. One of them is lupus, which can cause sensitive skin lesions and itching in regions such as the face, scalp, and arms. Another example is psoriasis, marked by reddish plaques and scaling, often mistaken for common allergies. In both cases, the immune system starts attacking its own body, causing constant inflammation. The great challenge lies in the fact that these symptoms, especially in older adults, are often normalized or treated superficially. But this can delay important diagnoses and compromise the control of the disease. Being attentive to changes in the skin and not settling for vague explanations can pave the way for a life with less suffering and more dignity. After all, aging well is not ignoring the signals of the body, but welcoming them with wisdom and attitude. In many cases, chronic itching is also related to adverse reactions to medications, which is quite common in old age as the continuous use of medicines increases over the years. Diuretics, pain relievers, antibiotics, and even some medications for high blood pressure or cholesterol can trigger side effects on the skin, resulting in itching without any visible changes. The big problem is that often this link between the medication and the itching is not immediately noticed, and the symptom is treated as something isolated. Therefore, it's important to inform the doctor about any changes in the body after starting a new treatment. Reactions like this, when not identified, can intensify over time. Knowing how to recognize patterns and document symptoms greatly helps in adjusting medications. The elderly body responds differently, and this attentive listening can prevent serious complications. Another less discussed but highly relevant factor is the impact of hormonal changes on the skin of older adults. With the drop in levels of certain hormones, such as estrogen in women and testosterone in men, the skin loses elasticity, firmness, and the ability to regenerate. This facilitates the appearance of irritations, inflammations, and itching. In addition, hormonal changes can affect the immune system and increase sensitivity to previously harmless substances. Apparently small changes, such as a localized itch that persists for weeks, can be the expression of an internal imbalance that needs to be evaluated. Instead of simply applying a moisturizing lotion and forgetting the matter, it's worth considering clinical monitoring. A simple blood test can reveal imbalances that, when treated, bring significant improvements, not only to the skin, but to the overall well-being of the older adult. It's worth remembering that the skin not only protects the body, but also communicates with it all the time. When something goes wrong internally, it manifests in some way. Therefore, symptoms such as itching, rashes, and texture changes should be observed carefully. Especially in older people, who already deal with multiple risk factors, careful listening to bodily signals is an essential act of self-care. Many families still consider these discomforts as something inevitable in old age, but this view needs to change. There is always a cause, and there is almost always a way to treat or alleviate the symptoms. The key is not to accept the discomfort as normal and seek answers. Even when there is no immediate cure, the correct diagnosis can ensure more comfort, safety, and quality of life. And that, in the end, is what everyone deserves as they age. The health of the skin in old age is directly linked to daily habits. Unbalanced diet, insufficient water intake, very hot baths, and frequent use of harsh soaps are factors that, little by little, compromise the protective barrier of the skin. This makes it more vulnerable to irritation and infection. In addition, environments with very dry air, common in cold seasons or in places with constant air conditioning, also favor dryness and itching. Simple adjustments in daily life, such as opting for cotton clothing, avoiding perfumed products, and including foods rich in omega-3 and B-complex vitamins can help a lot. The skin needs consistent care, and not just when it's already damaged. Small attitudes done regularly promote lasting results. Taking care of the skin is not vanity. It's a practical way to preserve health as a whole, with a direct impact on the well-being of the older adult. There is also an emotional factor that cannot be ignored. Anxiety, loneliness, and constant stress, so common in the lives of many older adults, can manifest physically in the form of itching and skin irritations. This is what many experts call psychogenic pruritus. In these cases, there is no visible lesion or a clear organic cause, but the discomfort is real and constant. When the body feels emotionally threatened, it can express this imbalance in various ways, and the skin is one of the most frequent channels. Therefore, taking care of mental health is also a way to alleviate physical symptoms. Pleasurable activities, moments of conviviality, empathetic listening, and psychological support when necessary are part of this comprehensive care. Seeing the person as a whole and not just treating the symptom is what guarantees a more dignified and respectful aging process. For all this, itching that lasts more than a few days, that repeats itself, or that appears without a clear cause should not be ignored. Even more so if they are accompanied by other signs such as weight loss, excessive fatigue, or changes in the skin. The attentive observation of these symptoms can be the starting point for important diagnoses, even when the discomfort seems small. It's common that, as the years go by, many people get used to certain discomforts and stop seeking help. But this needs to change. Listening to the body, valuing the signals, and seeking medical guidance is a gesture of self-care and respect for your own health. Prevention is still the safest way to ensure quality of life. And it's never too late to start paying more attention to yourself, especially when it comes to something as fundamental as the skin. In many accounts of older adults, there is difficulty in accurately describing the type of itching felt. Sometimes it's mild and constant, other times it comes in waves, intensifying at night or after a bath. Understanding the pattern of these symptoms can be crucial for the correct diagnosis. Noting when the itching started, where on the body it appears, and what seems to worsen or alleviate the discomfort are simple actions that greatly help healthcare professionals. Many doctors report that the lack of this detailed information makes it difficult to understand the problem, leading to generic treatments that don't resolve the cause. The more information is brought to the consultation, the greater the chances of an effective referral. And when the older adult cannot report everything alone, the support of an attentive family member makes all the difference in this process. Skin health is also a collective responsibility, especially when it involves more vulnerable people. Aging requires a new way of listening to the body. What previously went unnoticed now needs to be analyzed more critically. Itching is just one of the many signs that indicate internal changes, and learning to interpret it is an important step to aging more safely. Preventive medicine is still underestimated, but it's the main ally for those who want to live longer and better. Regular checkups, routine exams, and the habit of observing your own skin frequently can avoid unpleasant surprises. In a world where so much is immediate and superficial, looking deeply at your own body is an act of awareness. It's the one that sustains life, and ignoring its signals is giving up the chance to intervene in time. By understanding this, it's possible to act more calmly and clearly in the face of symptoms, without panic, but also without neglect. Edgar Cayce, even being a controversial figure, left us an important legacy: the idea that health is the result of the balance between the physical, the emotional, and the spiritual. Although his ideas are not recognized as science, they provoke a valid reflection on how we are dealing with the signals that the body gives us. Perhaps the secret is not in seeking ready-made answers, but in asking deeper questions about what each symptom wants to tell us. Are we listening enough? Are we paying due attention to the small alerts that the body emits every day? For many older adults, this type of questioning can be the beginning of a transformation in the way they approach their own health. More than treating diseases, it's about cultivating an active, conscious, and respectful posture with your own body, day after day. It's also important to highlight that access to quality information makes all the difference in this process. When an older adult or caregiver understands that a simple itch can be linked to serious conditions, they start to act more responsibly. The problem is that much of the information available is confusing or sensationalist, which ends up generating fear or distrust. That's why well-explained content like this plays an essential role. By offering clear and accessible knowledge, we give people real tools to take better care of themselves. This doesn't mean replacing the doctor, but rather knowing when to seek one. Itching, when understood as a symptom, loses the character of a simple discomfort and gains the value it deserves as a warning. And it's this change of perception that can lead to early diagnosis, correct treatment, and in many cases, a more peaceful and secure life. Many people believe that with advancing age, it's normal to live with certain discomforts without complaining. This idea needs to be urgently reviewed. Aging shouldn't be synonymous with suffering and silence. On the contrary, it's precisely in this phase that you should seek more comfort, more well-being, and more dignity. The itch may seem small compared to other challenges of old age, but it interferes with sleep, mood, and even social relationships. An older adult who itches constantly may feel ashamed, irritated, or even depressed. Therefore, addressing this topic with seriousness and empathy is a way to value health in all its dimensions. No one should get used to discomfort, especially when there are ways to understand it and resolve it. And this understanding begins when the importance of each symptom is recognized, no matter how small it may seem. It's clear that itching is not just a passing detail. It's a sign, a language of the body that deserves attention. At any stage of life, but especially in old age, listening to these signals is an essential step to take better care of yourself. The correct information empowers, guides, and helps to make more conscious choices. If you've come this far, it's because you value your health or the health of a loved one, and that's already a big step. If this content was helpful, consider giving it a thumbs up and subscribing to the channel. This way you help take this knowledge to more people who may be going through the same thing. Taking care of the skin is taking care of life. May this video have been an incentive for you to observe yourself more attentively, seek help when necessary, and never leave the signals of the body unanswered. We live in a society that still values active listening to the body little, especially when it comes to older adults. Often, symptoms are minimized, treated as a natural consequence of age, but there's a huge difference between what's inevitable and what can be prevented or treated. Recurring itching, discomfort in the skin, alterations that repeat, all this needs to be taken seriously. It's in this daily care that a healthier old age is built. Paying attention to small signs can avoid major complications in the future, and you don't need to be an expert to realize that something has changed in your own body. Just be willing to observe, record, and share these changes with those who can help. Taking care of health is a continuous exercise of presence, and the sooner you start, the better the results. The skin speaks, and it's up to each of us to take responsibility for listening. In addition, creating a skincare routine goes far beyond aesthetics. It's a gesture of respect and affection for yourself. Hydrating, protecting from the sun, avoiding long and hot baths, choosing comfortable clothes, and observing reactions to new products are simple attitudes that make all the difference. And more. The conscious touch, that moment when you apply the cream attentively, also helps to perceive alterations that would go unnoticed. For those who care for an older adult, these gestures are precious opportunities for care and connection. Often, a simple comment about itching can be the beginning of an important medical investigation. It's no exaggeration to say that paying attention to the skin can save lives. And this attention starts at home every day, with simple and continuous gestures. The skin is the visible boundary between the body and the world, and it deserves all our care. The most important thing is to remember that aging healthily doesn't mean being free from symptoms, but rather knowing how to react to them with wisdom. Itching can be uncomfortable, but it can also be an ally, a warning that something needs attention, change, monitoring. When we look at the body with this disposition for listening and action, we become protagonists of our own well-being. If this video helped you in any way, share it with those you love. Good information deserves to circulate. And if you want to continue receiving content like this, subscribe to the channel. Together we can transform knowledge into attitude and attitudes into more years of life with quality. Taking care of the skin, health, and life is a daily commitment. May this message inspire you to start today with attention, with respect, and with action.